I got my shot on June 23rd, the first day that it was available. Felt very lucky to be able to get that shot.
But this man, who does not want to be identified, was the last in line at the city-run pop-up clinic when they ran out of 1,000 monkeypox shots, and now he's wondering if he'll get a July 21st appointment for his second dose. He biked to the Chelsea Sexual Health Clinic from the Lower East Side for answers.
Happened so fast, I didn't get an actual printout of the proof of my first vaccination. So today they were able to at least give me that on paper.
But he still has no answer on an appointment. The city's health department opened the scheduling site prematurely and shut it down immediately, leaving many confused and unable to snag a spot. On Tuesday, the city reported 111 cases, double from the week before. Health officials are using contact tracing to track positive monkeypox cases, but emphasize getting this virus is not as easy as contracting COVID-19. And while anyone can get monkeypox, current cases across the 5 boroughs are spreading among social networks of gay, bisexual, and other men who have sex with men.
Monkeypox, unlike COVID, is really due to close contact and coming close in contact with the lesions with an individual who was infectious, unlike what we've seen with COVID. So they are different.
Doctors say monkeypox starts with a fever and flu-like symptoms, but also causes lymph nodes to swell with lesions that look like chickenpox. While the health department has received 6,000 doses of the monkeypox vaccine, the rollout has been rocky.
Are you a little bit worried about this?
Yeah, I'm concerned.
The United States is stepping up its efforts to address the escalating monkeypox outbreak as the number of cases reaches 700 in this country. The Department of Health and Human Services announcing yesterday that it will distribute 144,000 more doses of the vaccine starting Monday. That's on top of the 56,000 doses that the department made available last week. The CDC also announcing plans for increased testing.
Well, we need more now. That is demand coming from San Francisco officials today regarding the monkeypox vaccine. As cases slowly climb, demand for vaccinations has skyrocketed, but supply not there. NBC Bay Area's Pete Serratos joins us live from Zuckerberg General in San Francisco. And Pete, people lining up for hours to try and get this monkeypox vaccine.
Yeah, that's right. People have been here for hours at San Francisco General. You can see the long lines here behind me, all of them looking to get a dose of that monkeypox vaccine. But as many folks are scrambling to get the vaccine, you have San Francisco leaders blasting the federal government and their lack of supply.
Pretty pissed off is what I'm hearing from a lot of folks.
It's fair to say that San Francisco Supervisor Raphael Mandelman is fed up with the federal response to the growing monkeypox outbreak. Today, he stood on the steps of San Francisco City Hall alongside fellow leaders in the LGBTQ community, demanding that feds increase the number of doses they're sending our way. Supervisor Mandelman says LGBTQ leaders who were around during the start of the AIDS epidemic of the 1980s say the federal response is starting to feel like deja vu.
They're describing very similar feelings of knowing that there's a public health problem. San Francisco trying to address it, activists screaming about it and getting this, sort of kind of non-response out of the federal government.
The response so far has been just under 3,000 vaccine doses for the city. The supervisor introduced a resolution to the Board of Supervisors today, calling on the federal government to supply an additional 35,000 doses immediately.
We have a crisis now, and we can cut this off. We should be able to stop this from becoming an epidemic.
The number of reported monkeypox cases in the city currently stands at 60. Statewide, 150 cases. But health officials with the city say that doesn't tell the full story.
We know that that is an undercount because it has been challenging to get testing and people may not always recognize their symptoms. So we are really working on the presumption that many more people will need to get vaccine.
Take you back out here live to San Francisco along Potrero Avenue in front of San Francisco General. This long line for the drop-in site for the monkeypox vaccine. But I do want to mention that health officials say if you've been exposed to monkeypox, to get the vaccine as soon as possible. They say you have up to 14 days. Of course, it's better to get the vaccine sooner than later. In San Francisco, Pete Serratos, NBC Bay Area News.
Happening today, Colorado is trying to avoid a monkeypox outbreak as the number of cases in our state are slowly climbing. And our Justin Adams is live at CDPHE this morning. And Justin, today, the state is holding the first of 3 clinics for those at highest risk.
Yeah, and those clinics are extremely important. They will happen on Tuesday, Wednesday, and as well on Saturday. Now, the number of monkeypox cases in our state has grown to 9, and all of them are in the Denver metro area. Now, compare that to where they are nationwide, and the number of monkeypox cases in the United States is at 865, and that's according to the CDC. So far, nearly 700 vaccines have been administered in Colorado, and 400 more are scheduled to be given out this week. Vaccines are used to prevent infections and to shorten current infections. The doses of the 2-jab vaccine is limited, and the state will limit eligibility to the most at-risk groups.
The vaccine has been extremely limited. It's not available commercially, so any vaccine supply we're able to administer is from our federal partners. So with that extremely limited amount of vaccine, we're really focusing our efforts on those individuals who might be at greater risk or who had contact with a known case of monkeypox.
Now, folks who have already signed up can get the vaccine today, and an application is needed in order for you to go and get the vaccine. Now, right now, that application is closed on CDPHE's website, and there is a clinic that is planned for tomorrow and another one on Saturday as well. Live in Denver, Justin Adams, covering Colorado First.
Justin, thank you.
Thanks. Happening today, monkeypox vaccines now available here in Mecklenburg County. Although doses are going to be very limited, the state health department says these shots are crucial to help prevent illness or possibly lead to less severe symptoms. Wake Up Charlotte's Richard Devane joins us now outside the county health department in Southeast Charlotte this morning. And Richard, we know that these vaccines aren't available for everybody. Before we create a mad dash to go to get them, outline for us who exactly is eligible, at least at this stage.
Yeah, good morning to you, Ben. Good Wednesday morning, everyone. Yeah, the health department says this vaccination should not cause wide concern here in Mecklenburg County. It's only for those folks who have come into contact with someone who has monkeypox, and that's a limited number of people so far here in Mecklenburg County. They say they just want to get ahead of this problem before it gets too bad.
The Mecklenburg County Health Department will give vaccinations for the monkeypox virus. The vaccine can prevent illness or lead to less severe symptoms if given within 2 weeks after someone is exposed to monkeypox. Symptoms include fever, headaches, muscle aches, swelling lymph nodes, and chills, and exhaustion, as well as rashes that look like blisters. Currently, the vaccine is being offered to individuals who self-identify as high risk according to the following criteria. Anyone who has been in close contact in the past 14 days with someone diagnosed with monkeypox, or an individual who knows their sexual partner was diagnosed with monkeypox, or men who've had sex with men, or transgender individuals who've had multiple or anonymous sex partners in the last 14 days in either a venue where monkeypox was present or in an area where the virus is spreading.
It's not acting like influenza or COVID or chickenpox or measles, things that spread quickly in an unvaccinated community. It's acting much more like a disease that requires close contact.
And that is important to note, so it is not something that can be transferred through air or something of that nature. Of course, if you are somebody who needs to get one of these vaccinations, please call the health department. That number is 704-336-6500, or you can go online and set up an appointment as well. And starting today, you'll be able to get a vaccination. We're here in Southeast Charlotte. Richard Devane for Wake Up Charlotte.